Hi guys, finally we are down to our very last topic for our finals, which is malarial smear collection, preparation, and staining. So some people may carry a disease in their blood even if they do not appear to be ill. You cannot easily see the diseases in the blood, and sometimes the tests to demonstrate the diseases are very complicated. So the principal diseases are hepatitis, acquired immunodeficiency syndrome or AIDS, and malaria. Systemic or blood-borne parasitic infections are diagnosed by demonstrating the diagnostic stages of the responsible parasites in a blood specimen. Parasites that may be recovered in blood include Leishmania donovani, Trypanosoma species, Plasmodium, Babesia, and Microfilariae group. The proper collection and handling of blood specimens is essential to obtain adequate smears for examination. Trypanosoma and Microfilariae can be detected by observing motility in a wet mount preparation of a fresh blood sample under low-power objective and high-power objective. However, definitive identification requires demonstrating their features in a permanent stain smear. Blood smears can be prepared from fresh whole blood without anticoagulant, using your fingertip or earlobe, or from venipuncture collection with anticoagulant. Now let's proceed to the objectives of this lesson. First is to list the materials required for making thick and thin blood films. Second is to demonstrate the correct method for preparing a thick and thin blood film. And lastly is to demonstrate the correct way of labeling a blood film. The timing of blood collection for the study of malaria is crucial to success in retrieving the malarial parasites. The various morphologic forms of parasites visible at any given time depend on the stage of organism development at the time of specimen collection. For example, when the infected RBCs rupture, merozoites are present in the circulating blood. This stage, when found, is difficult to serve as a species identifier. However, gametocytes may be present at this point in time and they are readily discernible. The greatest number of parasites is present in the blood in between characteristic bouts of fever and chills resulting from the release of merozoites and toxic waste products from infected RBCs, which is known as paroxysms. Thus, this is the optimal time to collect peripheral blood samples to determine the presence of Plasmodium species parasites. The following are the essential materials which is needed for preparing thick and thin blood film. You need your latex gloves, clean wrapped slides, sterile lancets, 70% ethanol, absorbent cotton wool, sharps container, slide boxer tray, lint-free cotton cloths, lead pencil, and a small sharpener. After gathering the materials needed, now let's proceed to the collection and preparation of thick and thin blood films. The collection and handling of blood samples presents a potential risk of blood from a patient infected with one of those diseases mentioned earlier, accidentally contaminating another patient or a health worker. However, this risk can be reduced to a negligible minimum by taking the following precautions. First is you must wear your protective gloves when handling blood or taking blood samples. Avoid getting blood, including that from unstained slides, on your fingers or hands. And then cover any cuts or abrasions on your hands with adhesive dressings. And lastly, you must take care not to prick yourself or others with any sharp instrument that has been in contact with the blood. After selecting the third or the fourth finger of the patient, now you must clean the finger with cotton wool, dampened with 70% alcohol. You must use firm strokes to remove dirt and oils from the ball of the finger. And please remember everyone that capillary blood should be free-flowing and not contaminated with the alcohol used to cleanse the puncture site. Blood that is milk from the finger will be diluted with tissue fluids. which makes it difficult to detect the parasites. Anticoagulants cause some distortion to the staining process and subsequent parasite morphology, but most laboratories use venipuncture specimens collected with an anticoagulant. Blood specimens should be collected in tubes containing ethylene diamine tetraacetic acid or EDTA. The next step is to dry the finger with a clean cotton cloth using firm strokes to stimulate blood circulation. So, if you are suspecting that the patient is infected with malaria, it is best to prepare smears within 1 hour of collection because storage of blood for a longer period leads to the distortion and possible loss of malarial parasites. Similarly, malarial tests should always be considered immediately because this disease can rapidly progress to life-threatening complications. Next, using a sterile lancet and a quick rolling action, puncture the ball of the finger or toe. Apply gentle pressure to the finger or toe and express the first drop of blood. Wipe it away with dry cotton wool, making sure that no cotton strands remain that might later be mixed with the blood. And you have to remember this, everyone. So you must never use disposable lancets more than once. And always wash your hands with soap and water after completing any tasks that involves the handling of blood. If blood does get onto your skin, wipe it off quickly with cotton wool dampened with alcohol and wash the affected area with soap and water as soon as possible. And then, any materials contaminated with blood such as lancets, cotton swabs, and discarded slides should be boiled for 20 minutes or placed in a solution of bleach and sodium hypochlorite. The available chlorine level should be 1,000 parts per million or 1:10, then disposed of safely by burial or incineration. After that, working quickly and handling the slides only by the edges, collect the blood as follows. Apply a gentle pressure to the finger and collect a single small drop of blood and place it on the middle of the slide, as you can see on the picture. So this is used for the thin film. And you must remember this, everyone, that finger prick blood sample must be free-flowing to prevent dilution of blood with tissue fluid, which decreases the number of parasites. Then continue to apply further gentle pressure to express more blood and collect 2 or 3 larger drops on the slide, about 1 centimeter away from the drop intended for the thin film, and then wipe the remaining blood off the finger with cotton wool. Now let's proceed to the preparation of thin film or thin blood smears by using another clean slide as a spreader. In the slide with the blood resting on a flat, firm surface, touch the small drop of blood with the edge of the spreader, allowing the blood to run right along the edge. And please remember this, that thin smears are prepared in such a way that they are thick at one end and thin and feathery at the other end. Streaks and holes should be avoided in the film. Clean slides and spreaders are used, so after air drying, slides are fixed with methanol before staining. Next, for the thin film or thin blood smear, you must firmly push the spreader along the slide, keeping it at an angle of 45 degrees. The edge of the spreader must remain in even contact with the surface of the other slide while the blood is being spread. So this is how a thin blood film looks like, and it has 3 different parts: the head, the body, and the tail. And you are done with the preparation of your thin film. Now let us proceed to the preparation of our thick film. Handling the slides by the edges or a corner, make the blood film by using the corner of the spreader to join the drops of blood and spread them to make an even, thick film. Do not stir the blood. A circular or rectangular film can be made by 3 to 6 quick strokes with the corner of the spreader. Thick films are prepared from 2 to 3 small drops of blood, which are mixed and spread with continuous movement over an area which is about 2 centimeters in diameter. Films are then thoroughly dried and then dehemoglobinized prior to staining. Circular thick film should be about 1 centimeter or 1/3 inch in diameter, which is equivalent to a size of a 5 centavo coin, and that is a recall board exam question. The thick film should be dried and be protected from dust, flies, sunlight, and extreme heat. Under normal conditions, the thin film dries quickly. In the past, the patient's details, slide number, and date used to be recorded with a soft lead pencil on the thicker part of the thin film. Now, in the modern times, preferably frosted slides should be used in frosted and used as the label. Using the thin film as label is no longer recommended nowadays. You must be careful not to touch writing instruments to the blood film, and you must not use a ballpoint or gel pen to label the slides as the ink will spread when the film is fixed. Please remember, everyone, that when slides are not processed immediately, it can be stored in a desiccator before staining. And then slides that are correctly made leave little blood on the spreader. So the spreader slide can be used for making thick and thin films for the next patient, while another clean slide from the pack is used as the fresh spreader. This is how your thick and thin blood films look like on the same slide. So it is important to note that multiple sets, or you must prepare at least 2 thick smears and 2 thin smears as soon as possible after collection of your blood films, which, as noted, consist of thick and thin smears, are necessary to rule out malarial infections. It is recommended that the blood should be collected every 6 to 12 hours for up to 48 hours before considering a patient to be free of Plasmodium species parasites. The thin film consists of a single layer of red blood cells and is used to assist in the identification of the malaria species. After the parasites have been seen in the thick film, it is also used as a label to identify the patient. Thin smears are most useful in species identification of malarial parasites. The thick film is made up of large numbers of dehemoglobinized red blood cells. Any parasite present are concentrated in a smaller area than in the thin film, and so are more quickly seen under the microscope. Thick smears are used in the demonstration of microfilariae and rapid diagnosis of malarial infection. Careful and thorough screening of all smears is crucial to ensure the correct identification, reporting, and ultimately the proper treatment of all Plasmodium organisms present. After the preparation of your thick and thin blood films, blood films must be stored correctly in order to allow the thick film to dry evenly. They should also be protected from flies and dust. The best kind of box, both in the field and in the laboratory, is that shown on the right side of the PowerPoint slide. Slides are stored horizontally, which allows the thick film to dry level and with even thickness. There is a door to keep out flies and dust and a handle for carrying the box. Only after 100 slides have been collected, it is necessary to empty one side of the box before more slides can be collected. At the speed slides are usually taken in field collections, the first 50 will be dry before they need to be packed. When the thick film is completely dry, the slides are stored front to back in the empty cardboard slide box previously used for the cleaned, wrapped slides. In warm, humid climates, however, autofixation of uninstalled slides occurs quite rapidly and all slides should be stained as soon as possible, at the latest within 3 days of collection. When long storage is unavoidable, the slides can be kept in a desiccator to delay autofixation. Finally, it's important to ensure that the slides are packed correctly and that they are not put into strong sunlight or near to a source of heat, for example, exhaust pipe of a vehicle in the field. Alright, we are done discussing collection, preparation, and storage of your thick and thin blood films. Now let us proceed with the common faults in making your blood smears. First is the badly positioned blood films. So care should be taken that the blood films are correctly sited on the slide. If they are not, it may be difficult to examine the thick film. Also, portions of the films may even be rubbed off during the staining or the drying process. Next is too much blood. After staining films made with too much blood, the background to the thick film will be too blue. There will be too many white blood cells per thick film filled, and this could obscure or cover up any malaria parasites that are present. If the thin film is too thick, red blood cells will be on top of one another, and it will be impossible to examine them properly after fixation. The next one is too little blood. If too little blood is used to make the films, there will not be enough white cells in the thick film filled, and you will not examine enough blood in the standard examination. The thin film may be too small for use as a label. Next one is that blood film spread on a greasy slide. So the blood films were spread unevenly on a greasy slide, which makes examination very difficult. Some of the thick film will probably come off the slide during the staining process. Next is the edge of the spreader slide chipped. When the edge of the spreader slide is chipped, the thin film spreads unevenly. It's tricky and has many tails, as you can see on the picture. The spreading of the thick film may also be affected. Lastly, we have the thin film is too big while the thick film is in the wrong place. If the thin film is too large, the thick film will be out of place and may be so near the edge of the slide that it cannot be seen through the microscope. During staining or drying, portions of the thick film will be probably scraped off by the edges of the staining trough or drying rack. It may be very difficult or impossible to position the thick film on the microscope stage so that it can be examined. Now let us proceed to staining. Gemsa stain is an alcohol-based Romanowski stain, which is a mixture of eosin, in which the function of eosin is to stain your parasite chromatin in stippling red or pink, and methylene blue, which stains your parasite cytoplasm blue. So this will provide you as a made-up stock solution in bottles of 100 ml, 250 ml, or larger capacity. There are some important things you should remember with regards to the stock solution of your Gemsa stain. First is to keep the bottle tightly stoppered to avoid evaporation and oxidation of the stain by high humidity. Next is to store it in a dark glass bottle in a cool, dry, shady place away from direct sunlight. Next is, for daily requirements, measure small amounts of stain into a tightly stoppered bottle, about 25 ml, so that the stock solution is less likely to be contaminated. And then do not use water to the stock solution. Even the smallest amount will cause the stain to deteriorate, making staining progressively ineffective. Do not shake the bottle of stain before use. Shaking suspends the precipitates which settles on the films during staining, and it will obscure important details during microscopy. And then lastly, do not return unused stain to the stock bottle. So once the stain is out of the bottle, it must be used immediately or discarded. Now let us proceed to the staining of blood films with Gemsa stain. Right stain may also be used and will result in an accurate diagnosis. However, because Gemsa is the recommended stain for all blood films submitted for parasite study, the specific morphologic discussion of each Plasmodium species is based on the use of this stain. Both thick and thin blood films should be made and examined. There are two methods of staining with gemstain, the rapid or the 10% method and the slow or the 3% method. The rapid method is used in outpatient clinics and busy laboratories where a quick diagnosis is an essential part of patient care. The slow method, on the other hand, is used for staining larger number of slides, such as those collected during cross-sectional or epidemiological surveys and field research. Now let us discuss thoroughly the two various methods for staining your blood films with gemstain. First, we have your rapid method or the 10% method. You must fix the thin film by dabbing it with a pad of cotton wool dampened with methanol or by dipping it in a container of methanol for a few seconds. Avoid methanol or its fumes coming into contact with the thick film, otherwise fixation may take place and will prevent proper staining. Rapid method or the 10% method is the most common method for staining 1 to 15 slides at a time. It is used in laboratories where a quick result is needed to determine a patient's malaria status is required. This method is efficient but more stain is used. The need for speed justifies the additional cost. Next, use a test tube or a small container to hold the prepared stain. Make up a 10% gemsa solution with distilled or deionized water buffered to pH 7.2. If only one slide is to be stained, you will require about 3 ml of prepared stain. Allow 3 drops of stock gemsa solution from the pasture pipette to each milliliter of buffered water to give a 10% solution. Next step is to gently pour the stain onto the slides or use a pipette to drop the stain onto the slide. Then, stain the film for 8 to 10 minutes. Experience will indicate the correct time for each slide or batch of slides. Then, gently flush the stain off the slide by adding drops of clean water. Never pour the stain off the slides, otherwise the surface scum will stick to the film and spoil it for microscopic examination. Lastly, place the slide in the drying rack. Film side downwards to drain and dry. Make sure that the thick film does not touch the edge of the rack. Now let's proceed to the slow method or the 3% method. You must fix each thin blood film by dabbing it gently with a small piece of cotton wool dampened with methanol or by dipping it in a container of methanol for a few seconds. Avoid methanol or its fumes coming into contact with the thick film, otherwise fixation may take place and will prevent proper staining. So this method is less appropriate when a quick result is needed, but it is excellent for staining large numbers, 20 or more of slides. It is ideal for staining blood films from surveys or research work or batches of slides for teaching. It performs best when slides have dried overnight. So this method is economical because much less stain is used, which is 3% rather than 10%. Next, place the slides back to back in a staining trough, making sure that all thick films are at one end of the trough. Then, prepare a 3% solution of gemsa stain by adding 3 ml of gemsa stock solution to a 97 ml of buffered water. And make sure that the pH of our buffered water is of pH 7.2. Next is to pour the stain gently into the trough until the slides are totally covered. Avoid pouring the stain directly on the thick films. Next is to leave the slides in the stain for 45 to 60 minutes. Experience will indicate correct time for each batch of slides. After that, you must pour clean water gently into the trough to float off the iridescent or scum on the surface of the stain. The water should be poured into the end of the trough where the thin films are to avoid undue disturbance of the thick films. So alternatively, you can gently immerse the whole trough in a bowl or basin filled with clean water. Next is to gently pour off the remaining stain and rinse again in clean water for a few seconds. Then pour off the water. Lastly, remove the slides one by one and place them film side downwards in a drying rack to drain and dry, making sure that the thick film does not touch the edge of the rack. In addition to blood films, serologic tests and polymerase chain reaction or PCR techniques for malaria are available. These tests are not that helpful in regard to the actual treatment of malarial infections. However, one benefit of serologic testing is that this methodology does appear to help rule out malaria in patients suffering from a fever of unknown origin. And PCR techniques can confirm the malarial speciation, but is usually not necessary. Now let us proceed to the rapid diagnostic tests or immunochromatographic methods for blood specimens suspected with malaria. Rapid diagnostic tests for malaria have been developed that employ immunochromatographic methods based on the detection of malarial antigens present in the peripheral blood. So most of the tests use monoclonal antibodies and detect particular malarial antigens in the blood specimens. Tests have been developed that detect antigens including the histidine-rich protein 2 or the HRP2, aldolase, and parasite lactate dehydrogenase or PLDH. These tests generate results within 15 minutes and do not require skilled microscopists. Commercially available kits for HRP2 detect Plasmodium falciparum HRP2 only and therefore diagnose only Plasmodium falciparum malaria. The HRP2 antigen is synthesized and released by the trophozoite and immature gametocyte stages and persists in peripheral blood. Therefore, HRP2 tests can remain positive for up to 2 weeks following chemotherapy and parasite clearance as confirmed by microscopy. Now, those tests mentioned earlier have low sensitivities for detecting infections with low level of parasitemias, which is usually less than 100 parasites per microliter, and mature gametocytes. In contrast, trained microscopists can diagnose infections with parasitemias as low as 5 to 10 parasites per microliter. The reported specificities of these tests are high, which is greater than 90%. Early tests reported false positives due to cross-reactions with rheumatoid factor. But these issues have reportedly been addressed and corrected. Parasite lactate dehydrogenase or the PLDH is produced by the asexual and sexual stages of your gametocytes of the malarial parasites. Test kits that are currently available to detect PLDH from all 4 species of Plasmodium. They can distinguish Plasmodium falciparum from the non-falciparum species, but cannot distinguish between Plasmodium malariae, Plasmodium ovale, and Plasmodium vivax. Tests that can detect PLDH do not generate persistent positive results following chemotherapy like the HRP2 test. Currently, the only available RDT for malaria in the United States is the Binax Now malaria test. The Binax assay contains both the HRP2 for Plasmodium falciparum and aldolase, which is a pan-malarial antigen. It cannot separate non-falciparum species. The Binax assay should always be accompanied by thick and thin film microscopy. Now let us proceed to the reporting of malarial smears. So, microscopic examination remains the gold standard for laboratory confirmation of malaria. These tests should be performed immediately when ordered by a healthcare provider. They should not be saved for the most qualified staff to perform or batched for convenience. In addition, these tests should not be sent out to reference laboratories with results available only days to weeks later. It is vital that healthcare providers receive results from these tests within hours in order to appropriately treat their patients infected with malaria. So the first type of reporting is qualitative reporting, which is reported as negative, 1 plus, 2 plus, 3 plus, and 4 plus. And their corresponding meaning or interpretation is found on the right portion of our table. The second type of reporting is quantitative reporting, which is computed with the following. Number of malarial parasites per microliter is equal to the number of parasites counted over 200 WBCs counted and multiplied by 8,000. These are the various references used for our lesson. Thank you so much once again, everyone, for listening, and that ends our coverage for the finals of the parasitology laboratory. Have a nice day and God bless you all.